what I did well in my SP, I feel like communicating with the patient, between like interpersonal communication between clinician, me as a student, like clinician, and the patient went really well. I feel like I asked the appropriate amount of questions. I feel like I gave her answers maybe she wasn't looking for, but like answers that would have been appropriate for a clinician to tell a patient. With her surgery, I said that we need to go the conservative route before we just dive in and try to do a surgery, and try to worry about like her recovery time from the surgery, when that might not even be something that we gonna use at, like, she probably doesn't even need surgical intervention, and if we do a surgical intervention, like, they don't always work. So let's try to do it conservative route. So I felt like that was a good way to answer a question, and her other questions were answered appropriately. The special tests I did do, they were executed well, I felt, and I also felt that like I did the scapular rhythm and appropriate manual muscle testing. I did not do well because I didn't look at shoulder flexion. I looked at shoulder ab and adduction and internal and external rotation, along with many other motions, but I didn't look at shoulder flexion. So that's something I did bad. I did not do the proper special tests that are associated with instability, but with her, like, given her history and like palpation and what she was weak on for her MMTs, you could tell that like she had shoulder instability. Like, I didn't like diagnose her with something that was completely off because I diagnosed her correctly, but I should have been more prepared to do those sorts of tests. So what I can learn from this is that I need that, like, my shoulder eval is obviously a weakness for me, and so what I can apply to future patients is that I can work on strengthening these skills so that whenever I encounter another patient like this, I can make sure that I do the proper special tests to rule in or rule out a pathology, but also keep in mind that do not rely on special tests, and also focus on like the history and the patient themselves, because those things can tell us more, and sometimes special tests aren't always reliable. I'm done.